as we've seen this weekend, the epidemiological situation of Montreal preoccupies us. Today, we have more than 19,878 cases. We deplored 2,000 deaths, most of them being linked to the outbreaks that we're seeing in CHSLD and RPA. And we have more than 3,700 healthcare workers that have been infected by COVID-19. That represents more than 20% of all the cases that we have in Montreal. So this is a situation where we still have a lot of work to do in the community, but also with the outbreaks that we're seeing in the CHSLD and elders residency. We have had a lot of people asking us to give portraits of what is being done and what we're seeing in specific neighborhoods. Tomorrow we will have on our website those portraits available for all the population to see what is happening in the different boroughs of Montreal. The good point we're seeing is that since last week, we're seeing a plateau in the number of new hospitalization linked to COVID-19, and we're seeing a reduction of new intensive care unit admissions and emergency admissions for COVID-19. So what we need to do is to maintain this plateau or this reduction to see the end of the pandemic. Last week, we've launched the regional strategy to increase the screening, the testing that we're doing at the population level. The objective is to do more than 3,000 a day. Since the end of April, we've almost doubled the number of screening, passing from 1,000 a day to almost 2,000 a day in the center for screening that are in different neighborhoods. And we've added unit mobiles that are going around Montreal. Today we have 3 in services, and at the end of the week we will have 5 of them going in different neighborhoods. So you can have the schedules and the places where the unit mobiles are on our website, Santé Montréal, and we're asking people in those neighborhoods that have symptoms or people that do not have symptoms but that have been in contact with someone that is symptomatic or was sick to come to the unit and get tested. We have a capacity for each unit of more than 200 tests a day. And today I wanted to talk more specifically about our elders. And a subject that is quite important to us because we're not deconfining right away, and we know that we are asking a lot to them. In Montreal, we have more than 265,000 elders of more than 70 years old. A third of them live alone in their house, and 90% of them are not in CHSLD and RPA. As I said, we have looked a lot at the critical situation in those establishments, but I think it's important to also make sure that we care about the 90% that are at home, currently at home. We know that, of course, they are more at risk of having a complication or a severe form of COVID-19. People more older than 70 years old are 11 times more at risk of having a severe form of COVID-19, and people over 80 years old, it's 22 times more at risk. So that's why we're asking elders to stay at home and to reduce at most their movements outside of the home and their contacts with other people. But confinement has also other impact on health. It causes isolation, psychological distress. Of course, we can see malnutrition or nutrition problems linked with the fact that people do not, they have to eat alone, they prepare less meals. And the other thing that we see is deconditioning or deconditioning of or reduction in activity. And that's why we are launching today a new program that was developed in partnership with Move 50 from a Cercovie from l'Estrie, the region. It's a program where we're asking you elders, but also families of elders, to go on our website, and we have different units, 15 minutes units of activity that are really adapted to all conditions. If you are healthy, if you have difficulty walking, you're in a wheelchair, you have 5 different categories of activity that can be done at home, and we're really asking people to do it, because at the end of confinement, it can make a difference in your autonomy and the risk of falls or the risk of, and on your mental health, of course. So I think that was the main message that we wanted to share today. I think we have all together. We have to be solidaire, to be solidaire for our elders by respecting the public health recommendation. We're also respecting our elder and making sure that they can also come out of the house earlier, or they can go back to a normal life soon. So thank you. I think it's all together that we have to give this message to our elder.